Okay, hello everyone. Today in this episode, we examine how point-of-care ultrasound can help primary care providers differentiate between congestive heart failure and chronic obstructive pulmonary disease exacerbations in real time. We will discuss a compelling case that highlights how POCUS led to rapid diagnosis and appropriate treatment, avoiding unnecessary delays and hospitalizations. Dr. Tatiana Havryliuk is an emergency physician and founder of Hello Sono, 15 years of experience using POCUS in diverse settings from urban EDs to Everest Base Camp. She is dedicated to extending its benefits to more patients. With Hello Sono, she and her team support practices in building compliant, high quality, and profitable POCUS programs through tailored education and implementation. So let's talk about this case and just how POCUS helped distinguish between those two exacerbations in a primary care setting. So just share about the case if you would.
Sounds good. Great to see you again, Randy. And so in this case, we had a patient um, in her 50s who came in with some dyspnea, kind of very non-specific symptoms otherwise. When the provider examined them, there was a little bit of wheezing going on, maybe some pedal edema, but not conclusive. And their O2 sat was slightly lower than normal. And this patient had the known history of COPD and CHF. And basically, at this point, the provider gets to decide, like, hey, do I go with CHF exacerbation and increase their diuresis? Do I treat them for COPD? Do I treat them for both? Do I need to get some more imaging, send them maybe for a chest x-ray to see whether there's fluid overload? And instead the provider decides to do POCUS to really get a clearer answer so they can guide management. And POCUS showed abnormal findings consistent with fluid overload, pulmonary edema. Point of care ultrasound of the lungs showed B lines, which are abnormal lines. If you go to the actual article, you could view them. And
Yeah.
they also scanned their inferior vena cava, and it showed some dilatation and also not a lot of variability when the patient was breathing, which is also consistent with fluid overload.
Let's do the third question. Um, so that's interesting. So, what are the practical steps for primary care providers to start using POCUS for respiratory complaints?
Well, first, it's important to develop competency. So it's really knowing what you're looking for and then uh, completing the appropriate training process for your specialty. And usually that does involve hands-on course, some online asynchronous learning, followed by a period of preceptorship where your actual lung ultrasounds are educational at first, and you're submitting them for review by experts and getting feedback so you can improve and make sure that you are um, doing this correctly. And then, of course, you also want to have a structure of how are you performing the lung ultrasound, right? You're not just randomly putting the probe on a patient's thorax. There's really, depending what you're using, you might be looking at the lung in three different fields on one side and three different fields on the other side, or you might be looking at more fields if you have really high suspicion for a small abnormality. So you might be sitting patient up, looking at their backside as well. So really sticking with a protocol as well would be helpful, especially in the beginning. And then you also have to have your workflow set up of how you're going to do it, how it's going to fit into your day to day. Um, and that does involve what devices you're gonna get, how are you gonna log in, how are they gonna be kind of attached to, are they gonna be handheld devices attached to your phone, or are you gonna have a tablet in the office, or you're gonna have a device that you're moving from one location to another? And then how are all of these exams that you're performing, how are they going to be saved securely in your EMR or somewhere in PACS potentially on a cloud and also how you're going to document them. So there are quite a few steps. And obviously, once you start documenting, you can also bill for them, right? So having that whole workflow set up is also important. Um, I feel like I just said a lot of things. Do you have any
Well, no, but
clarifying questions for me?
no, no, because some of it goes back through things we've discussed in previous episodes too about the totality of implementation. And one of the things, so this would be sort of a what you might say an intermediate or an advanced skill set to look at pulmonary issues, respiratory issues, lungs, and things, or would you say this is more of an intermediate?
I would say it's more a beginner if
Okay,
you're looking for very specific type of questions. If you're looking for fluid overload, it's actually very simple.
okay,
Um, and if you're looking for pneumothorax, it's simple. It gets a little bit more complicated if you're looking for pneumonia, and pneumonia is a little bit, it's on a smaller side because you might need to be scanning in a lot more fields than you're used to scanning, depending on the protocol you're using. So that could be a little bit more subtle.
okay. Well, that's good to know. And of course, um, billing and coding implications of this particular type of diagnosis. Would you want to elaborate a little bit on that?
Yeah, basically, whenever you perform an ultrasound, you need to save images or clips of the representative images that you're seeing on the screen. So you would be saving, for example, if you're doing the protocol and it's showing, and you're looking at three spots on the left and three spots on the right, you are actually labeling them and saving them on a cloud or somewhere. You need to be saving
Yeah,
them securely. And then you also need to be, documenting your findings, putting in your final impression, and putting all of that in your EMR before you can bill for it. And the billing, if you're a primary care practice and you are not like a outpatient department of a hospital, then you
right.
can actually bill for both components, the technical component and the professional component. So basically you're billing the whole global fee for this test. And by CMS reimbursement, it comes out to around 50 something dollars, like a nationwide reimbursement rate for this, which is still going to be cheaper than sending the patient to get an x-ray somewhere else. And, you get a diagnosis on the spot and you can make a better decision. And imagine, your patient satisfaction scores. Like the patients are going to be like so thrilled to have it done on the spot and see what's going on with them.
Yeah, and those are pretty big issues to be able to do with relatively beginner, intermediate level skill set. So very exciting, very cool. That's is there any other questions you think that we might want to throw in here? Because I mean that's really good. I think we got it, but anything else that you might think that I might want to ask? And I know a lot of it comes back to things we've talked about before, and I think that's kind of cool because you're sort of reiterating the process. You're reiterating uh the infrastructure that has to be in place. Saving images, all those things that we've talked about before. But anything
I,
particular about the case?
I mean, I think, yeah, like the financial implication of managing CHF patients uh, in the outpatient setting, right? Like if they are
Right.
avoiding ER visits, if they're avoiding hospitalizations, like and on average, CHF patient, the healthcare cost is $30,000 per patient per year. And a
Oh,
lot of that cost comes from being in the ER,
yeah.
or, getting admitted. So if you can diagnose fluid overload earlier and start treatment earlier and avoid sending people to the ER, that would be a huge cost savings. Um, and also when you're, part of different MCOs,
Yeah.
right? You can be also having like a financial benefit for your clinic if you're saving overall healthcare costs.
Oh, yeah. Being able to do this in an outpatient setting and knowing that is saving. Well, I think the patient, like you said, patient satisfaction.
Hmm.
And then, yeah, just additional costs in an ER visit or something of that nature. So once again, it's the cost effectiveness. the patient satisfaction side, instant gratification, but they know what's going on earlier and sooner, and then you're able to treat. And if it was something, more urgent, knowing sooner obviously is always better. So, well, this was cool. Another good topic, another good case. Thank you for joining us again on our POCUS Focus, and we will. What are we going to do next month? I'm sorry.
I think we're gonna hit up some eye emergencies and headaches.
Oh, cool. Headaches. Yeah, I need that one.